Tracline have been providing computer systems for 25 years now, and the last 10 years we've been specialising in the health service. Tracline's hosting the mobile point of care show because we found that in the previous years that we've been dealing with trusts, there's been little sharing of information and good practice. There doesn't seem to be many places where you can hear success stories in an open forum. So we found both last year and this year, by having this forum around the country, we are encouraging an open, frank exchange of information from trust to trust.
Salford Royal's using the mobile point of care by having the MCAs and laptops on carts, and what that allows us to do now is access patient information at the patient's bedside. So we have an electronic patient record system, so therefore our clinicians can access that information at the point of care. We can request blood tests. Our phlebotomy service can collect bloods all at the side of the patient.
Well, Alder does now use mobile devices. We're a hospital that looks after over 200,000 children and young people a year, and it's really important that we find out from the users of our services what they think of the quality of service that they're experiencing. So something that we're very keen on is how we can use mobile technology to give us real and live information with a series of structured questions which allows children and young people to engage actively and give us some really valuable information which can help us improve our service provision.
Mobile devices, it's very, very easy to access children in lots of remote areas. You don't have a problem with infection control. You don't have to use a paper system, which has always been a bugbear, taking time and effort to fill paper copies out. It's good from the point of view that children actually are very used to mobile technology, so that's something they're very accessible and very adept at using.
At Shrewsbury and Telford we're using mobile devices for a variety of things, but probably the most important is the Vital Pack application, which we use for monitoring patients' vital signs. The most significant change is the improvement in the completeness and accuracy of observations taken on patients. These have gone up from probably 40% to well over 95% in most wards, and you can now get a clear, legible observation chart on every patient in the hospital.
Real benefit in trusts who've adopted the ICE desktop application and mobile point of care. For example, the Royal Brompton in London, they've based their phlebotomy services around positive patient identification, the printing of request labels at the bedside, and the sampling of the tubes as and when they're taken from the patient.
Benefits to using mobile devices is, I think, it's time. It's the fact that you've got the information where you need it. So previously you would be searching maybe for the medical records, or maybe another discipline has got the medical records that you actually need. So now you can actually, as many mobile devices you've got, you can access the record.
Well, the benefits of using mobile devices in this population is traditionally it's been very unreliable as to what sort of feedback you can get from children and young people. So we're very confident now that using mobile technology and the characters that we can adopt into this mobile technology, that the feedback we're getting is firstly accurate and secondly useful, so that we've already experienced information which has allowed us to improve services.
I think there's clearly been an improvement in the recognition of sick patients in the trust and more appropriate referral of those patients to either more senior members of the team or to critical care. At this point, although we've got some quite tantalising, interesting results with regard to mortality of patients, we're really not at the point yet where we can kind of publish those, but they're certainly starting to look very interesting.
Could the trust do without the MCAs? I would think not, really, not to go back just to pure desktops at all. This really has allowed us to develop our electronic record by having, again, the access, the information, most up-to-date information at the point of care, which is where the patient is.
I think in today's climate it would be very difficult for the trust to work without mobile technology in these examples. As I said before, we've had lots of experience of trying to find out from children and young people what they think, but it's been a very slow, cumbersome process, and we haven't been convinced by the sort of information we've got back. So casting my eyes forward, I think it would be very difficult from this point onwards to actually work without this sort of technology.
Now we've actually got medical and nursing staff used to having mobile devices at the bedside. There's a huge opportunity to replace a lot of the tasks that they were traditionally doing on paper with tasks that can be done more easily on computers. I'm really looking forward to being able to give every single doctor in the trust a PDA on which you can see the patient's observations, their bloods, their radiology reports and their letters.
I think everyone's walked away with a very positive view that they're not alone, everyone's on the same page, and that yes, we're on the winning side. Next 3 years, very interesting. We see the landscape and the NHS changing dramatically because it has to. It has to become more efficient with budget cuts, and it has to use technology more effectively. And in this particular market space, that means mobility.